Chair, menopause is a biological process that marks the end of a woman's menstrual cycle and fertility, and it typically occurs between the ages of 45 and 55. It is a universal experience for women across the world. But the journey to this point is known as perimenopause, which can last for several years, and this is what I'll focus on today. The perimenopausal stage in a woman's health remains in the shadows, under-prioritised, under-resourced by policymakers, employers and healthcare providers alike. Perimenopause is overlooked despite its relevance to health, education, employment and demography. During this transition into the menopause, a woman's body undergoes various changes as it prepares to end its reproductive years, and typically begins in the mid-40s, but can start as early as the mid-30s and last as long as the mid-50s. It usually lasts for about 4 years, but it can extend to up to 8 years. And during the perimenopausal stage, estrogen levels fluctuate, leading to irregular menstrual cycles. And as the ovaries gradually produce less estrogen, it can cause various other symptoms. Now, perimenopause is diagnosed based on symptoms and menstrual history, and the treatment focuses on managing the symptoms, which may include lifestyle changes, less so hormone therapy, and other medications. The symptoms of perimenopause can affect daily activities. They affect work and they affect relationships. And in my constituency of Broxtowe, women have told me that they've needed to take time off work due to the symptoms that they didn't understand and needed their healthcare professionals. And we know that absence from work has a significant impact on our economy. And as been previously said, it can cost billions of pounds per year. Some women need to reduce their working hours, they need to take time, extended leave, or actually leave the workforce entirely. And this can affect their career progression, considering how young they are. So at a time when the government is focusing on growing our economy, we cannot ignore the economic cost of not helping and supporting women in their perimenopause. Few women seek help or attention, but due to lack of understanding, they receive very little support. Their symptoms might be subtle, and they will come on gradually, and they may not even know that they're connected to hormone fluctuations of the menopause transition. More women, or many women, do not even understand the signs and symptoms of perimenopausal stage as the menstrual cycle continues. And it's this lack of awareness of an education of the perimenopause among both women and healthcare providers, which leads to underdiagnosis and undertreatment. I raise this issue today because I would like to go back to my constituency and assure them that perimenopause will be included in any future government policy.